Every 40 seconds, someone in the U.S. has a stroke. So today in Your Health, we learn how to recognize the symptoms and cut down on our risk for stroke.
We say good morning to registered nurse Kathy Pollum and also Dr. Heather Stanko, who is Bellin Health's Director of Strokes. Good morning to both of you.
Good morning.
Well, let's talk about what exactly a stroke is, because it can be a lot of things.
Yeah, so a stroke essentially is brain damage that is caused by lack of oxygen or nutrients to the brain because of damage to a blood vessel, caused either by a clot developing in the blood vessel or ending up in the blood vessel, or a rupture of the blood vessel.
And there are signs ahead of time to know if you are having a stroke. There's an acronym that people should be aware of, correct?
Correct. So that's probably the most important information you can take from this discussion is we use the acronym B FAST. B is for balance. It's a sudden loss of balance or coordination. E is for eyes. So you may have vision trouble, double or blurred vision, or losing the sight in one or both eyes. F is for face. You ask the person to smile and look to see if they have facial drooping on one side or the other. A is for arm weakness, so we're looking for weakness on one side of the body or the other. You can have them hold their arms up and see if one is weaker. S is for speech difficulty, so if they have trouble speaking or their words aren't coming out right, or maybe they can't get their words out at all. T is for two things: terrible headache, and it's time to call 911. It's not time to second guess these symptoms. Get in and get checked out. Very important.
Are there any things that put you at a higher risk for stroke?
There are several different risk factors that increase the risk for stroke in addition to heart disease. So the most common risk factors and the risk factors that you really want treated to prevent strokes includes high blood pressure. That's probably the #1 risk factor, high cholesterol, poorly controlled diabetes, smoking and other tobacco use. And then we also would want to mention atrial fibrillation, which is a heart rhythm condition that needs to be treated in order to prevent stroke.
And speaking of prevention, are there ways that we can have this preventing it from happening?
That's a very good question. So the majority of strokes are preventable by modifying these specific risk factors and knowing what your own risk factors are. So figuring out if you're impacted by any of those risk factors and adjusting your lifestyle to make that less of a risk. So, you know, eating more healthy, what does that mean for you? If you're diabetic, keeping your glucose in control. If you're high blood pressure, you check it more often and make sure it's being controlled. It's very important, and always recognizing those symptoms and getting in for treatment right away with the acronym B FAST.
Can you give us an idea of what life is like after a stroke?
So strokes can cause damage to different areas of the brain. So it's really the area of the brain that matters as far as any residual problems after a stroke. Some people can recover completely and you may not even be able to tell they had a stroke. Other people may have problems that persist. The most common would be weakness. We can see numbness, walking difficulties, speech difficulties. And then we also can see memory problems after a stroke. And then there can be some symptoms that are linked to the stroke but isn't like a physical problem. So we do see an increase in fatigue and depression and anxiety just because of the medical event itself.
All right, well, great information this morning. So ladies, thank you very much. And if you want to learn more, Bellin holds a stroke support group the first Monday of each month from 4 to 5:30 in the evening. For more information, you can just head to bellin.org/calendar or give a call to Deborah at 920-433-7977. Ladies, thank you very much.
Be fast. Be fast.
Be fast.
Remember it.